So let's get into a solution, and that can be a breast lift. So can you talk to us a little bit about how that works?
So basically what we do with the breast lift is comparing with the breast augmentation, you're reshaping the skin, moving the nipple areolar complex to a more normal position, you lift that, and then you take the excess skin and you redrape that skin around the breast tissue. You can do that by itself, or you can do that with an implant to give more fullness, especially in the upper pole fullness that you want to create after you do a lift.
And sometimes you even have a lift and you don't need to do an augmentation.
Yeah,
correct?
You can use your own tissue.
Okay.
And you reshape the tissue and redrape the skin around the tissue and you lift the whole thing. Mm-hmm. Now you have the other different thing that you can have too big of a breast and then you have to do a reduction. But when you do a reduction, you're also doing a lift because most time the reduction, the breast is hanging down.
Right.
So when you cut the tissue, you also do a lift at the same time with the breast reduction. So every breast reduction will have a lift. Now, not every lift is a reduction.
I like that. Now, who's a good candidate for this type of procedure?
Well, always like I told you before, we do an examination, we check the patient. Like a heavy smoker patient is not a candidate because that will imply that you're going to have microvascular problems of the circulation and that can cause wounds and problems. But any person that have any skin condition that is a problem, any patient that is not compliant, sometimes it can be that. And like we talked before, real expectation what you're going to get.
Right.
If you think you're going to have a lift and you're going to be there like that forever, you're not a good candidate because you won't be happy.